I'm Lori Ballard, a nurse educator who is very passionate about helping you get organized and ready for NCLEX. And so I want to talk to you a little bit today just about a very general introduction to NCLEX. Let's get started. So the purpose of NCLEX is to measure foundational knowledge and skills that are needed for safe practice. So the NCLEX exam tests for a minimum level of safety. If any of you have done any type of predictor exams, you know that you can pass one of those predictor exams and you still don't feel anywhere near ready to take NCLEX or anywhere near ready to start your nursing practice. So another thing that is in my book are different ways to help you not only prepare for NCLEX, but to also feel better prepared for practice. Of NCLEX, again, is to ensure overall safety of the public, to protect them, and it is also legally defendable for your license. There are some integrated processes, things that are built into every part of NCLEX, every question. Nursing process, it will require clinical judgment. Caring is also in every question. And this can be something very simple because you think, well, how can they tell if you care? Because they're just testing minimum level of safety, not all the kind of bells and whistles and fluff. But, you know, they can tell by your interventions if you're taking a warm blanket to a patient that you obviously care. Other integrated processes are communication and documentation, teaching and learning, and then cultural and spirituality is built into an integrated process of the NCLEX questions. So some fun facts: it takes 7,000 nurses and over 210,000 future nurses to actually come up with the question bank that NCLEX uses. So that question bank is a total of over 12,000 questions. So every 3 years, they do a practice analysis, which is a survey to make sure that what they're integrating into NCLEX actually reflects day-to-day practice. So the NCLEX exam is reviewed every 6 months. Every so many years, they will also adjust where they set their passing standard, which that really has more to do with the algorithm of the adaptive exam. So items that are deemed out of date or incorrect can be removed from NCLEX within 24 hours. They go to great lengths to make sure that NCLEX is up to date. It's not a specialty exam. Again, it is a generalist exam. And so it's not intraoperative, it's not in the OR, it's not critical care, it's not OB, it's not intrapartum or specifically pediatric, and there are only select mental health concepts. So that's not to say that you won't have a scenario of a question in those areas, but it is not specifically geared towards a specialty. That's another reason why in nursing school you don't specialize as a particular type of nurse. You know, you seek employment in those areas, and if there's any additional training, then your facility or employer can help you with those. And a lot of times they'll take care of the cost for that as well. History of the current test plan. In 2009, there was a comprehensive white study because a lot of employers and facilities and healthcare in general was finding that there were a lot of errors with entry-level nurses. They were making practice errors. They were failing to act at essential times, and over 65% of the errors that occur were related to poor decision making. And because of that employer satisfaction, that put into motion a lot of research that was done. From 2012 to 2014, NCSBN did 2 major studies, and so new grads were missing 3 of the top 5 required entry-level skills, which were clinical judgment, problem solving, and critical thinking. So that prompted from 2017 to 2022 a practice and research, and they came up with the current test plan that is next generation that you see. So there's some specific item types that they feel like is a better way of determining clinical judgment. But I think the important takeaway of those new style of questions is, when is it appropriate to guess? So in 2017, the RN Nursing Knowledge Survey it ranked that overall importance and was another contributing factor into the new test plan, or the current test plan, which has been in effect since April of 23. This is information on the clinical judgment terminology. The new clinical judgment terminology has to do with recognizing cues, analyzing cues, prioritizing the hypothesis, generating solutions, how you take action, and evaluating the outcomes. Now, if you notice, that sounds super familiar and directly related to the nursing process. So how you kind of delineate against the two is that the clinical judgment model is more dealing with how we teach you to think, where nursing process is specific to patients and patient care. So the other thing on this slide is showing you how they overlap and how they correspond. So again, clinical judgment model terminology, nothing about nursing process changed. It is always there, will still be there, and the clinical judgment model, again, is just a way that we help you better recognize and start those critical thinking skills. One of those new style of questions that is in the current NCLEX test plan is a case study. Really, I don't think this is anything new. It's just in a different format. A lot of students that I've talked to, they really like this format, because if you're like me and you're an overthinker and you read a question, but I want to know this and I want to know that, with the case studies, you can click and open tabs and look for that additional information that you want. So it's very user-friendly. They wanted to simulate what is a more day-to-day practice, and so the case studies are kind of built that way. Some fun math that go along with NCLEX is, these next-gen questions, really, if you take the exam and you finish in 85 questions, there's probably only going to be about 18 questions that are these new next-gen styles. So it's certainly not anything that is changed everything. There will be 3 case studies. Now, 15 of those questions are not graded. The pie chart and the original piece is the NCSBN's test plan and what percentage is in which of these client needs areas or NCLEX category areas. You have a maximum of 5 hours to complete the exam. NCLEX does a very good job of making sure that they do what they can to reduce testing anxiety. So there aren't trick questions on NCLEX. It's a minimum level of safety. What didn't change about the NCLEX test plan? The predetermined passing standard. The nursing process has not changed. Pathophysiology has not changed. The standard of care and our nurse practice acts didn't change. The RN's responsibility to initiate the plan of care. The client needs categories, so that pie chart of all the different categories and the percentages there, they did not change either. Computer adaptive testing, the algorithm and the proprietary information of how you take that exam did not change. Your exam can be 85 to 150 questions. NCSBN publishes the test plan. This is my website and the QR code. They will find my book. So I hope you guys have enjoyed this video. Thank you so much. Have a great day.